The time. Welcome to the Mornings with Ed show. It's a Monday, and always on Monday, and becoming quite a popular segment according to the listeners and the questions that you ask. Dr. Anita Wong is with us to talk about wellness, and we welcome the doctor. Good morning, doctor. How are you?
Good morning. You know, I didn't like Mondays before, but now coming here, I have something to look forward to on Mondays, and I actually enjoy Mondays now. It's like the best day of my week.
It's just about the best day of my week as well. I look forward to it from Tuesday onward. I'm not kidding. And our listeners are into it, and that makes me happy. And thank you so very much for taking the time. I know you're busy. I know your schedule is packed. And you making this time for us really is it's beneficial to the entire community. We don't think about wellness enough.
No, I mean, that's my whole thing. I want to empower people to be able to care for themselves and put a lot of companies out of business. No. I think we can do it. No.
All right. Well,
I'm a capitalist, but in a different way, then we can work on other things.
Right. So I'm going to hit you with a couple of personal questions first, if that's okay with you, before we get rolling into our subject matter for the day. I just went and got blood drawn. I've gotten just for a regular reason, my year checkup. Everyone should have a full checkup once a year.
Yep.
So I got blood drawn. I can't wait till you go over my results with me on what it means, how my cholesterol, all of that. So I can't wait for that. But do you find that, first of all, I didn't realize that you had to drink a lot of water before.
Oh, yes.
So
yes, you don't want to go in there dehydrated.
It was a slow drain. It was a pretty slow drain for me. I had a glass of water about 4:30 this morning, a nice tall glass, but that was it. That was it for the day. So it was a slow drain for me.
Yeah.
I fasted, obviously, since yesterday. I've been fasting since about 8 o'clock last night, which meant no coffee.
Nope.
Changed my life. This morning, I don't know if any listeners even cared, but I was a different person this morning. I'm hooked on the caffeine. I'm just told So, no matter what, would it make a difference had I drank decaffeinated coffee? Would that have been like drinking water?
No.
No?
I mean, there's water added to that, so it's filtered, so yeah. But we wouldn't have been as dehydrated because the caffeine is a natural diuretic, so it may have been a little bit beneficial.
Okay.
But.
All right. So, well, we'll go over my results, and enough about that. I feel healthy. I feel healthy when I get my physical. I feel healthier, at least knowing that somebody's got an eye on me. And I'm sure your patients feel the same way.
I hope so.
So what are we talking about today?
You
tell me.
I'm telling you, did I not?
You didn't send me anything. That's okay. You didn't send me anything.
I worked all night and I sent you and made it and sent it over. Okay, so
let's see. Hold on. I'm going to check while you're talking.
Okay, so well, actually, what I wanted to mention is that this week only, I have 80% off on M-Sculpt.
Oh.
Yeah, but specifically for the biceps, triceps, and the calves.
Okay.
So 80%. So if you can get yourself in, book that for this week. So if you need a little maintenance, or if you're not certain about it, you can give it a little try.
So describe M-Sculpt to the audience and exactly what that does and how they can benefit from it. And so I sent you the listener questions, and then you just sent me back and okay, no worries.
No, I sent it earlier in the day, in the morning.
All right, here, let me check it again. No, I'm checking it again here.
I sent it
because
to...
I can pull this up right now. Hold on, here we go.
Okay.
I love live radio for this reason.
Okay, so but M-Sculpt is it's the same technology as an MRI, right?
Okay.
And so it actually I can't because it's on the I don't know. Anyway, so it is electromagnetic, and it by magnets produces contractions. And so what I was telling somebody is that basically, we are very powerful.
Right.
And we don't really realize that until your kid is under the car, and you just lift that car up, and then able to get your kid from out underneath the car, right? So you have superpower strength. But your brain wants to protect you and make sure that you don't overuse it. So you never call upon it until it's a real emergency, right? Well, M-Sculpt is that superpower, and it calls upon your muscles and pulls that strength that you don't know that you have. So it's basically, you have to kind of let the mind go, especially like the core, because it's a little sensitive. So people have kind of resist that and fight that just to relax. But it's actually not painful. It's just like severe, strong contractions. So these contractions are at an intensity, the machine is at 1 Tesla power. So that's a lot of power.
Okay.
And when you contract that on the abs, let's say, that is 20,000 crunches in 30 minutes at an intensity at super power, right? So the equivalent of that will take you 80 hours in the gym.
Yeah.
So 30 minutes equals to 80 hours. Now, I'm not saying that you're going to do 30 minutes and never work out, because you want to use the muscles. It's just to get you back, especially if you're one of those who've never worked out, you don't have any muscles. I mean, you didn't do weight training and your muscles have atrophied, and you're in that 50 to 70 age group where that is where majority of the muscles are starting to, you're starting to lose that muscle mass,
Right.
and you haven't done it. This is a great tool to build it back up. Build it back up, get back to where you would have been, and to maintain it, and then go and use them. So that's what M-Sculpt is about, is to use them. So I'm having a fire sale, so if you want to have some guns and want your biceps and your triceps to look awesome and your calves, come on in this week, because you get 80% off.
I love that. So, okay, so I'm going to ask you right now about my six-pack. So, my six-pack is not what it used to be, and maybe there's a layer of fat right there. M-Sculpt will give me the head start I need to then work out off that layer of fat, right?
Yeah.
It doesn't shape the fat; it works out the muscle underneath.
Okay, so there's a couple of things, right? So the muscle mass development is between increases between 16% to 25%. There's on my notes that you do, but
Yeah,
so
by the way, you know.
I know. I did all that work, and then I stayed in bed and didn't send. So that's why. Anyway, so we're gonna talk about Amsella. So anyway, so the so you actually gain the muscle. So up to about 25% increase in muscle mass. And fat reduction is between 16 to 30. So it depends on what kind of treatments, what kind of settings I put on, and what we do. So you're gonna lose some fat. So you can lose, but majority, if we're just doing M-Sculpt itself, you're gonna lose the internal visceral fat, which is the unhealthy fat. So all the fat around the organs, your omentum and all of that, because it's an intensity, you're working out, your metabolism increasing, and so you're melting that fat away, and it goes into the lymphatics. And then the other is if I use some radio frequency, then it's going to melt the buttery coating on the outside, right? So it just depends on what we want. Because if you're lean,
right,
you don't want me to melt that off on the outside. You want to have some subcute, some buttery outer coating. You want to be all skin, muscle,
right,
bone. You need a little bit of layer of fat, and that's healthy. Your body needs that. So we have to do the adjustments to make that. So so you can have that loss up to 30% of fat and a gain of up to 25% of the muscles on the machine, and then you got to go use them. Right? And then the same thing you can do in the pelvic. So that's why I was asking you, because on Amsella it's the same technology, but you're sitting on the paddles, right? So most people. Now, I don't know how you bench press or you lift dumbbells with your pelvis. I don't think many people can do that. I mean, unless you're doing like the bridge and you take a weight and you put it on your pelvis and you're lifting it up. And then if you're doing your Kegels, and maybe if you put something in there for ladies and you're really working out, squeezing, but people don't work out their pelvis. So
And squats. If I were to do squats, for instance,
Oh, yeah.
that is a pelvic workout
yeah.
for the most part.
Oh yeah, you're using
Okay.
pelvic. Any of those, yes. Those the deep a deep squat. You're using the large muscles, large muscle groups.
Right.
Some of it, but you're not going to use a little bit more of the pelvis where you actually kind of squeeze the butt cheeks together, right? And get the Kegel motion going on. So the Emsella, what it does is in 28 minutes does 11,000 Kegels with the superpower. Right? So if you're leaking, dribbling, all of that stuff, there's the fix for that. So that was why I was thinking it was like so fortuitous, but.
So some of the listener questions that you're going to be answering here relate directly to how you can help them. I love that. So I know that they're listening now, because once they ask a question, they're listening to the following week. So I love that. Thank you. So when you say they sit on the paddles,
so it's a nice comfy chair. People come in, they read their book, they get their work done, they go through their phone. So you're sitting there for 28 minutes and just managing your life while you're doing that and getting superpower strength in your pelvis, which actually helps with stable. So, as we get older, right, you start to lose the muscle mass, right? So if you'll see elderly people, they're shuffling, they don't pick up their feet, right? They're kind of stooped over, they're looking at their feet, they're concerned they're gonna fall because they're a little bit off balance. You see people holding them, they're using walkers. But it starts in the pelvis. If your pelvis isn't strong, you don't have a steady gait. So come in, sit on the chair, get a strong pelvis, even if you're not leaking, even if you're not having issues. The other thing that it corrects is ED. So that just gripes me that people are going and taking a pill. And I know that it's their diet isn't good, they're not managing things well, their circulation is poor. They can improve their circulation and improve their pelvic health and muscles and correct ED. You don't need a pill, you just need to have the good circulation and good muscles. So this treatment is this for that was the big thing that I wanted to say, is because I've been using it off label in that treatment because it's FDA cleared for incontinence for men and women. But now it's just gotten its FDA, and it had gotten it for a while, but I had forgot to mention it. But now it's FDA cleared for erectile dysfunction. That's a huge thing. Now I knew off-label, so I was doing that off-label beforehand, and now we needed the studies to show it. Now the studies show it and confirm it, and that's what it's doing because it's contracting, building up those muscles. And guess what? When that happens, you don't leak as much. You don't get up in the middle of the night as much. You don't pee as much. So that's it. So you need to have the pelvis. So if you're not going to do your Kegels all day long, 24/7, 365 days, because that's probably how much you're going to need, because you're not doing it with a really intensity, 28 minutes, right?
That's fantastic. So 30 minutes on one machine, 28 minutes on the other. If someone wanted to double, is that a danger? Does that become...
Nope, I do. Some people come into my medical gym. They come into my medical gym maybe for a couple of hours, just like they go, but it's a different kind of workout, right? They'll come in and they know they're going to spend 2 hours. They're going to do the Emsella. They work on their pelvis. Then they want to get their core done on the M sculpt on the abs. Then they felt like they need a little bit of a glutes, right? And then they felt like they needed some arm work. And they get the arm work. Maybe they need the calves not. All of that's going to be a couple of hours more. So they'll block out 2 hours like working out at a gym, but it's a medical gym. And during that time, they actually can get some work done. And then when they actually go to the gym, they feel like a super hero, because they say, I'm stronger in Pilates. I could do a headstand in yoga. I could lift more. My buddies were in the gym and they're like, what happened to you? I have a 22-year-old volleyball, but they're like, what happened to your vertical jump? Why are you so clearing so high? He comes in, he gets that all done.
It can increase the vertical leap. Wow.
Well, for this guy, it does.
Wow.
Yeah, that's why he's there.
Okay.
He's a young guy.
Right. And if someone would, let's say a listener wanted to come in and do multiple parts of the body, like chest and arms, and should they do it all at the same day or different days?
Yeah, we don't do chest.
Okay.
So if you have a pacemaker,
Okay.
if you have a metal in the direct area, so if you have a hip replacement, you can't sit on a chair.
Okay.
You probably can't have the abs. It's a little too close. You could probably do the arms because it's a magnet.
Right.
It's gonna heat up. So it's MRI. Same things as the MRI. So you can't have it near the magnet. So when you're working, you can't have the phone in your lap where the magnet is. It has to be up and out of the way. So I have a specific table. You put things up there. It's on there. That's good. I have a little thing that goes around your neck for your phone, so you're not touching anything. So so there's limitations on that. Was the sad thing for me, because when I was developing my practice and figuring out what am I going to do, I took my cues from the ER, and the ER, I saw a lot of incontinence, and nobody talked about it, and they were ashamed, embarrassed, and it would always come out as like, oh, I'm sorry, do I smell? I need a pad, or I change clothes or something unrelated to their visit, and they didn't want to mention it, and now they need to because we're undressing them and things are changing up.
And you may as well, you're in front of a doctor.
Right. But they typically don't. I said, do you ever talk to your doctor? No, I just figure it's part of, it's just aging. There's nothing you can do. Right. And I don't want surgery, right? So I took that I was going to be the incontinence queen. That's what I decided. I'm going to work on that. And then my dad was complaining of all these things. He was getting up in the middle of the night, not sleeping well. He was, going frequently. Anywhere we go, we had to be by the bathroom at a restaurant, anywhere, couldn't go to the movies, anywhere, all these things. So I said, that is just the quality of life deteriorating. So I thought, this is why I'm going to focus on that. And unfortunately, he fell and broke his hip. He was in Boston and broke his hip. He missed the toilet and sat on the floor and broke his hip. And
now he's 90.
He was
90.
At that time he was 88. He lived to 90. He passed in 2020. But I set the program up for him. He wasn't able to benefit from it, but my mom has. Oh my gosh, she has totally benefited. So I started working with her at 88.
Did she suffer from incontinence?
She did.
Okay.
She was getting up every 2 hours. She had poor quality sleep. She would say, I used to be so active. I used to do so many things in a day. Now I can just do one thing. I think I mentioned this to you before, but I said the other day, she said, yeah, I golfed in the morning, I fished in the afternoon, and I cooked dinner. I mean, she says, I'm back to my old self. She's doing more than one thing a day and has lots of energy, and she's 93. So she benefited. My dad didn't get the benefit of it, but that's how I started it, because I was thinking about incontinence is an issue. And then my mom said, my gait is steadier. And then I said, well, yeah, it's core to floor. The floor, you have to have the floor, has to be stable. And she says, I don't understand it, but I can walk better now. And I was like, yeah, she had a steady gait, and she feels stronger. She's got muscle. She always comes in when she's here to make sure she gets her abs and cores done for her golf game, because she wants to make sure she has a good, strong core for that.
I'm not sure our listeners are really. I don't think they get how lucky we are to have you in the community. This is such a great, regionally, not just Laguna Beach, but Newport Beach, Dana Point, to have you so close and to have the ability for that, for elderly, for anyone really to take advantage of these. I strongly recommend it. She's on Thalia. What is the special you're running again?
80% off on biceps, triceps, and calves this week.
Okay, that's amazing. You might just see. Are you ready to answer some questions?
Sure.
Okay.
I love.
And again, I picked these at random, and they just happens to fit in with what we're talking about here. A 61-year-old male asks the question, does replacement of a hip cure the hip arthritis that I suffer from?
Okay, so I'm gonna put two hats on, right? Conventional medicine hat and functional medicine hat. So the conventional medicine just says that's part of aging, right? And that you gotta live with it. Nothing to do, we just have to kind of, do regenerative things or, and replacement surgery. Functional medicine is, we can't correct structural things that have already happened. But if you had a non-inflammatory lifestyle prior, you could have prevented having those changes and having arthritis. So arthritis to me is a disease. Aging is a disease, and it's not normal to have deteriorating joints. So people always say, oh yeah, because one of the questions is, I tell them their height. Well, I used to be 5'10", now I'm 5'9". And my doctor said, that's just normal. That is not normal. It's just not normal. It may be normal for everybody and to think of it, but it's not. So that means you are not hydrating and taking nutrients and supporting the collagen. Yes, we lose collagen 1% per year after the age of 18, but does it have to be to the point that you have a disease? No, because there's things you can do to prevent that. So that being said, you're not in prevention mode, right? So you cannot correct that issue, but the things that can help it. So if you have a little bit of cartilage that's still there, you can certainly support it. You can't regrow it. You can support what you have there, stimulate what growth. And if you have some growth and some stem cells and things, what all our body does, and you can stimulate the growth there, yeah, you can do that. So sometimes, some more invasive things like putting stem cells in, doing all these regenerative things, they certainly can help and regrow if you have some. If you're bone on bone, you're behind the 8 ball, okay? But if you have a little bit something there, if you have some collagen still there, then the key thing is muscle strength. Now, when you lose your muscles, guess what happens? Everything falls onto that joint. It's like a door hinge, right? It's like the hinges. The hinge is the joint. The door is the muscles. Now let's just say that the hinge is, coming out, right? And the door, you're swinging the door, and the door is just not quite right, and it can't swing properly. But if you fix that frame and you fix all the supports, the hinge is gonna, and the hinge is fine, but it's falling out of that frame and it's not tight enough, and you fix it up, and then the hinge works right. So if we tighten up and build up the muscles around that joint hinge, you may have less weight, less trauma on it, and may be able to support it, and it could feel better and have less pain. But if it's bone on bone, yeah, destined to have a hip replacement, that type of thing. I mean, if there's, so there's those types of things.
So beautifully explained, first of all. Thank you for that, for the clarity. And I think I'm just going to follow up with one question. So the 61-year-old goes in for the hip replacement, gets the new hip. And it depends on whether or not they've lived a fairly uninflammatory lifestyle, whether or not the arthritis is gone, or...
So the arthritis is in the joint itself.
Right.
And you're having pain because now you don't have the lubrication, you don't have the pad. It's like the brake pad is gone, and then now you're just grinding away, right? So now that you have the replacement, they lopped that off. So you don't have that joint. You don't have now you're gonna have an artificial joint. So you're not gonna have that pain. Now, so that pain will go away because you're not gonna have that particular pain. Then it just depends on healing process. Are you gonna have a different pain from the surgery? Not everybody escapes pain-free from surgery.
Right.
Some people do, some people don't. So you want to do, the most important things is make sure you decrease your inflammation, make sure your diet is good, and then recovery. And everyone should probably do well afterwards, so generally they do well. But it's a longer process, and usually people don't realize it's really a year process because the body takes about a year. But the surgeons will say, oh yeah, you'll be up and running about 3 months. But that doesn't mean you're gonna be normal and fully functioning and feeling well. because the process of the healing process really takes a whole year, because all the cells, everything's go in, the nutrients, they build things up, and it usually looks angry. So the scar may look flat, and then in 3 months, all of a sudden it looks red and angry and raised. That's because it's building all that, the bridge that it needs to. And then they break that bridge down and make it flat and look smooth. So they are doing this process. It takes about a year. But do you get to use it and move your body? Yeah. So you'll be using it in a few weeks time, few months time, but that whole healing process is going to be going on without you doing it. I think that's why I love the body. It just takes care of itself. It takes care of you. If you take care of the body takes care of you.
You're so good at this. You're so good at this. Thank you for that, by the way. A question from a 20-year-old female. And by the way, I should remind our audience that when you ask a question to the doctor, she has to have a chance to examine you. Again, always go check with your doctor on these questions and the answers, but thank you very much. A 20-year-old female asks, what and where should I be feeling for during the breast self-exam?
All right. So I think that you're going to use the pads of your fingers, right? You're going to be feeling things that are, I don't know, so if you've been checking, you kind of know the way it feels. If you haven't been checking, it's all going to be surprised. There's going to be little lumps, there's going to be little things in there. So I would always coordinate with your doctor and just say, I felt this thing, is this normal, right? Because there's going to be, it's not all smooth when you're really pushing on it. So you're going to go around all the breast tissue, around the nipples, kind of in a circular motion. You want to squeeze the nipple, and you want to make sure you go under the armpit, because there's a breast tissue under the armpit. So you're kind of massaging and just going around circular motions, doing the whole breast itself. And if you at different depths. So if you do it at very superficial, you'll just feel the skin, and then if you go a little deeper, you're going to feel the sub-Q. It might be a little lumpy, because if that fat is lumpy, you might go down deeper. You might feel a little, fibrous things. So it depends. So you'll feel different things, but once you know what is normal, then when you have an abnormal thing, you're going to know it. But if you're feeling a large lump, that's probably not normal.
What should you be feeling for when you squeeze the nipple?
So you're going to be looking for discharge.
Okay.
Yeah.
Okay. And that would not be normal?
That's not normal. If you're not
discharge.
lactating, if you're not breastfeeding or anything like that.
Okay.
You don't have a little tumor in the brain or something.
Thank you for that. A 45-year-old female asks, she says, I have been suffering from incontinence for about a year. Is there a medication or treatment you recommend? We just talked about it.
I know, that's why I was saying it was just so wild. Anyway, okay. So,
And it's incontinence at 45, do you see that a lot?
oh yes, oh yeah. I see it in young people sometimes. It's pretty, but so a couple of things. Conventionally, they're going to give you a medication to see if you have an overactive bladder and kind of stop that. So some people just want to go the medication route. You can certainly do that. Then if they feel, and then if you should have be examined by your urologist or your gynecologist, somebody, see if you have a cystocele or see the bladder has dropped a little bit. So then they're going to tell you the degrees of that, whether or not they think that you need a sling and you need to have surgery, that type of thing.
They surgically put a sling?
They actually, they bolster it up, but they call it, I don't know exactly how, but it's a sling they call it.
Right.
They lift the bladder back up. So eventually you can do all of those things. But the other thing, preventative wise, so if I would imagine maybe she had children or whatever. If you had, then you're going to have maybe weaker pelvic muscles. So doing your Kegels, getting a strong core, all of that, having a good diet that actually builds up muscles, getting your aminos and your vitamins. So the bladder system also actually has to have certain vitamins and nutrients to be healthy. So if your diet is fast food and there's not a lot of out of card box and things like that, you're not getting enough nutrients. So it needs an anti-inflammatory. It's always back to my 4 pillars.
Right.
Back to the 4 pillars. And then you got to use those muscles. So so you can go to the medication route. You can do the surgical route. You could do the Umcella route. And then I would check your nutrient levels. I would monitor that. look at that, and then you sit on the chair twice a week for 3 weeks. 6 is the minimum, 10 sometimes I've seen people, and then depending on how, what's your aging process, if there's a maintenance, I always say once a quarter. Some people need it once a month. I have one lady who only does it once every 9 months. So it just depends on what's your activity level, your basic level, your genetics makeup, on how much muscles that you have, things like that. So I think that was her question, right? About what to do?
Right. Is there a medication or treatment you recommend? Emsella.
I say Emsella would be the thing to do.
So if, let's say after 10 Emsella treatments, she's still suffering a little bit from this, would you recommend additional Emsella?
Yeah, sometimes I do the FEM, which is, so that's FDA cleared for increasing vascular flow. And so the treatments are for postmenopausal dryness and laxicity, and you can also make it look, as Jada Pritchard says, she says, her peach now looks like a peach again. So if you're into that, you can have that.
Right.
Because I am aesthetics, it's not my thing. But anyway,
Right.
But so it's an off.
I love how honest you are. I really love how honest you are. I swear.
So, but it is but what the side effect of it, because it increases vascular flow, it brings blood flow and it lifts the urethra up. I even sent you a diagram.
See, you didn't hit send is what happened. I'm looking at the computer right now. You did not hit send.
I'm going back and I'm sending it in. So it lifts the urethra up, and then with the blood flow. And when that happens, it helps with stress incontinence. So there's 3 types of incontinence, right? Stress incontinence is when you cough, sneeze, jump, do all those things, and you leak. And this FEM works for that. The Emsella chair works for an urgency when you have to go. You just really, you got to go now. You can't hold it for another second. That's urgency. And then the other one is mixed. People have a combination of the two. So Emsella will do both. And FEM only off-label does the stress. So if you're significant enough or something, I may recommend that we combine the two together to really bump that up. And increasing blood flow certainly can help. And better intimacy is always kind of nice.
Yes. And I'm just realizing, as you said, you sent the diagram with it, so it may have gone into a different file.
No, I didn't send.
Okay, all right.
So I know. That was the first thing I did that morning in bed, and I know I didn't send.
Okay. And this kind of dovetails off of that. A 37-year-old male, which I think is really young to have gotten this question, but apparently not. A 37-year-old male continues to dribble after urination.
I know, that's why I thought, how is this so?
This is
like
kismet.
I know.
Yeah.
So okay, I love this because I want to know, what do you know about the prostate?
I know that I fear the exam every year.
So what does the prostate do?
The prostate controls the urine flow from the bladder to the penis, correct?
Okay.
No.
No. So we have. So what are the reproductive sex organs of the female?
Oh, come on now. Just let's go. Let's move on. Let's move along here.
Well, no, I want to know. I want to know if you know.
I don't.
Oh, you don't?
I
Okay.
don't. Let's just go.
Okay, so that's good, because then that just tells me the mindset of people, because the prostate is a reproductive sex organ.
Right.
And so I would assume maybe women mostly know that their ovaries and their uterus and all of that is part of the reproductive organs, right? And men would think their penises, their testicles, right? But they don't think about the prostate. Okay, so the prostate is part of that. And so I've talked about the 4 pillars, and so I know somebody had asked us about this before. Oh, but before I go there, so what I was going to say is that in puberty, so we know during puberty, our hormones are changing. So in men, their hormones are changing in puberty. So, but it can go a little bit later, and they can have development. So later, their prostate actually enlarges a little bit. Right? So this gentleman, maybe he was a couch potato, maybe he ate processed foods, maybe whatever his diet. He didn't have the greatest diet, and his hormones during the puberty caused his prostate to be larger than it should be at this age of 36. So now he has a large prostate, and that prostate actually secretes fluid into your semen, and it secretes it, so it pumps it in there. So it into the it's regulated by testosterone. No, so it's actual fluid.
Okay.
So it's actual. So the prostate is around the urethra, which is your water tube out of the penis, and that's also where you're going to ejaculate the semen. So now when you're ejaculating, the prostate puts in fluid for the semen to be a little bit more fluid to go through the urethra. So since the prostate's around that tube, when it gets bigger, it's going to squeeze the tube down a little. But it's a reproductive organ, and so if your hormones were not imbalanced, it can become larger. And as we age, our hormones are changing, so things change with that. So people take saw palmetto, if they have too much testosterone, saw palmetto, stinging nettles, those types of things to balance some of that out, to try to reduce the size of the prostate. So for this gentleman, maybe he needs to take some herbs, maybe he needs a better diet. I don't know if it will reduce the size because it's a surgical thing, because I said we can't change structural things once they've happened, but maybe he can prevent things from increasing. But if his pelvic floor muscles are not strong, then he could also be leaking. So we could mitigate if his prostate's large, but maybe it's not the prostate. Maybe it's just the pelvic muscles. Maybe it's a nutrient thing. Maybe it's an anti-inflammatory. Maybe it's a diet thing. So the leakage. So Emsella would be good for him, but we'd have to evaluate it. But I would say Emsella would be why, and he would have to go to get his prostate checked, figure that out. So that's where I think on that one.
Thank you so very much, and thank you for not forcing me on that quiz too. I'm lousy at quizzes.
No, because it just.
I remember the chart from high school. I remember.
No,
the
it
chart.
just gives me an idea of what people know about their bodies, right? Because I'm so fascinated about it. I'll go research everything about the body. I want to know what's going on, and and I see people every day. Okay, you guys are just gonna have to wait here, because I have to tell you a story from the ER.
Please.
Because this is how little people know about their bodies. Okay, but and people they come in. So I'm in the emergency room. It's crazy busy. I got people having heart attacks, having strokes. So it's really busy. It's like 2 o'clock in the morning. This couple, very, very young couple, early teens, like early 20s, whatever. Late
teens, early 20s.
Right. So they're in there, and they're asleep on the gurney. I pass them a million times because I keep triaging them. You're fine. I got a new emergency. I finally get in and wake them up, and I look at the girl, and I ask her, "So why are you here?" She said, "I'm sick." I'm like, "Okay, so," oh no, she said, "I'm not sick." And I'm like, "Okay, you're not sick, so you're in the ER because you're not sick?" "Yeah, I want to know what's wrong with me because I'm not sick." And I'm like, "Okay, I don't really know how to answer this question." And then she said, but her boyfriend next to her, with his head over on the gurney, stooped over, and he looked like death warmed over.
He was definitely sick.
He looked ill. And I was like, she said, "Look at him. He's got a fever. He's sick. So why am I not sick?" I was like, oh my God. And I said, I think you need to be seen. Don't you want to? No, I'm good. Don't want to come in. No, I said, "You waited all this time. No, I don't need to be seen." And I said, you have a strong immune system. You should be thankful.
Right. So I remember that now, as you were speaking, I remembered the chart from high school, and I know the two reproductive systems. I'm like remembering the chart that they used to pull down. Let me ask you about a 34-year-old male, and I have one question that I didn't include in my prelim with you. But a 34-year-old male who in the last few weeks notices a metallic taste in his mouth after working out. What might that be?
Okay, so a couple of things. So he could probably is a heavy breather when he works out. He may also be working out very strenuously. So if we just focus on the working out, that means that he is actually, you're going to bleed into the lungs a little if you're breathing heavy like that.
Okay.
And so when you break down red blood cells, you're going to release a little bit of iron. You're going to have that metallic taste. So key for him is hydration. He's probably starting dehydrated. Microvasculatures are getting ruptured. So he needs to hydrate and breathe through your nose, maybe have it filtered. Not be such a heavy breather, but you want to breathe, maybe dial it back a little bit, maybe you're overdoing, so you can get rhabdo. I mean, people have gotten into the hospital and had rhabdo, which
that?
basically is where they worked out so hard that they broke down their muscles so much that the CPK enzymes is so elevated that it's detrimental, and when you have so much protein that breaks down like that, the kidney filters can't filter it, and you end up have kidney failure. So you need hydration. So that also happens with severe workouts. So so that's one thing. The other thing about metallic taste, if you have it without working out, which is one of my key questions in my intake when I have people, is do you have that metallic taste? So that tells me that your liver and your biliary system is just not working well. And well enough, or you're detoxing, or you're letting those chemicals out. So it's part of your detoxification. So if you have that, you probably need to look at your detoxification system. Probably do a green smoothie that I have on my website, which you said to take it down.
Yeah.
But just drink that to clean things out. Do that every now and then. Give your liver a little help, biliary system, and clean that out, because that means that you're having troubles detoxifying, or maybe you've got too much heavy metal, some stuff in your body.
It is so beneficial that you're really good at this. You're a scientist first, an MD and an ER, and you talk wellness. And I don't remember telling you to take that green drink down. I think I told you to keep that up, and actually,
you told me to sell it.
Yeah, that's what I said. Yeah, sell it.
I'm giving it away free.
I know. That's the only mistake you've ever made. Sell that shit. So a question I didn't include in our prelim was the restless leg syndrome. What is that, and how can it be cured?
Okay, I'd have to look at my peripheral brain on that, but there is a key thing with it, and I look it up every time, because it is, and I thought it wasn't. So I know that there's medications for it, things like that. I can't remember if it's from the magnesium or for the hormones, but I'd have to look that up again. But it's ironic, because that is something that I put on my thing that I need to remember, and I can't remember it.
I give you the send button.
So I have it somewhere, but that is, but yeah, because it's a simple fix.
Okay. Oh, perfect. And again, so 80% off this week. Tell us what
Yeah. Oh yes. 80% off on the biceps, triceps, and calves this week on M-Sculpt. And if you want to figure out how to do that, you can just message me. Go to my website, ANITAWANGMD.com, and you can send me a message, or you can book a call. But if you can't get a call right away and you really want to do it this week, then also text me at 949-734-0580, or leave me a voicemail, because I don't pick up the phone.
Same with me. Thank you.
Right, and and I will get back to you.
Dr. Anita Wong, you're right on the corner. The office is so conveniently located here in Laguna Beach, right on the corner of Dahlia and Glen Erie. I cannot thank you enough. Our listeners cannot thank you enough for these answers to these questions. We always look forward to Mondays.
Thank you.
Thank you.